So here I am going to talk about some question and answer with explanation. This question collected from NCLEX board. It is a review question. I believe it can help you. The first question: how long after oral administration should a nurse expect to see digoxin or lenoxin go to the peak effect? So medication, when we took the medication after certain time, it go to the peak level, or when 50% dissolve, they can produce their most effect, we call half-life. So in this question, they said how long oral administration of digoxin take time to show their peak effect, maximum efficacy. 1 to 5 minutes, 10 to 20 minutes, 30 minutes to 2 hours, or 2 hours to 6 hours. Answer is 2 to 6 hours. So within this time, they go to start their maximum effect. What is the rationale? The peak effect of digoxin occur 2 to 6 hours after administration of oral dose, and 1 to 4 hours after IV route or IV dose. Digoxin onset of action range from 30 minutes to 2 hours after administration of an oral dose, from 5 to 30 minutes after IV doses. So question here in rationale, we learn 2 points. One is digoxin onset of action, right? Onset of action and the peak effect is not same. Onset of action means when the drugs start to action. Peak of action or peak effect means when drugs go to their peak level. They in this level, like here you start the medication, right? You took it orally, then it's go dissolve, go to the blood, and go get up to the certain concentration level. Here it is peak, show the maximum effect. After showing it, medication go down again, right? And it starts to the baseline, then it's finished. So peak effect is here and onset is there. So after take the medication, usually digoxin onset of action, they can start to work within 30 minutes to 2 hours after admin oral dose, or 5 to 30 minutes quicker in IV route. You push directly to the blood. IV route, it is rapid, then orally form, right? It is 30 to 2 hours, but here is a 5 to 30 minutes. But in case of peak level, peak effect, it is show digoxin show 2 to 6 hours if admin orally. But if you admin IV route, the peak hour also change 1 to 4 hours. Good question. What next? Next question here: in what position should a nurse place the head of the bed to obtain the most accurate reading of jugular vein distension, right? So in some medical condition like right side heart failure, the jugular vein going to distended. It is the typical characters of right side heart failure. So now question is here, in what position? What position the nurse plays to read on to get most accurate reading about the jugular vein distension. Bed or head of the bed should be 30 degrees, right? So what are the 30 degrees? It is called Fowler posture. So if it is this and then it is 90 degree, this is 90 degree here, 90 degree, right? So like 30 degree around like this, but here 30 degrees. So Fowler positioning, a position assumed by the client when head of the bed is elevated 40 to 60 degrees, but it is 30 degrees. I know the Fowler is 40 to 60, but this 40 to 60 is close to this out of all. So it is not a high Fowler posture. So what is the rationale? The nurse should measure jugular vein distension, we shortly call JVP, jugular venous pressure. So jugular vein distension with head of the bed elevated between 15 to 30 degrees. The position allows the nurse to obtain vertical distension between sternal angle and the point of highest pulsation. The nurse cannot observe increase the pressure when the client is supine or when the head of the bed is 120 degree, because the point that makes the pressure level is above the jaw, therefore not visible. In high Fowler, the veins are barely discerned above the clavicle. But particularly, we are here to learn. What we learn? We learn when we need to get accurate reading, the jugular vein is distended or not. If the right side heart failure occur, our patient position should be 30 degrees or in between 15 to 30 degrees, right? What next? Next question here. Which condition most commonly result in coronary artery disease? You see, the question is how simple it is, and this question for NCLEX board. NCLEX board question like this. This question came in NCLEX board. Which condition most commonly result in coronary heart disease? So CED, coronary heart disease. So question is here, in case of coronary heart disease or CAD, right, which condition most commonly result occur in coronary artery disease? What is one? Renal failure, myocardial infarction, diabetes mellitus, or atherosclerosis? So some student answer, let me check what she wrote. Okay, so a student wrote atherosclerosis. So atherosclerosis is an answer. Wonderful, right? So the rationale is atherosclerosis is the leading cause of coronary artery disease. So if you have high cholesterol, or if you have high triglyceride level, high LDL means low density lipoprotein, or if you have less HDL, or if you have a total cholesterol is more, you have a chance to develop atherosclerosis. Let me recap it. I told you, if your patient have LDL is higher, low density lipoprotein, they are bad cholesterol because they collect the bad cholesterol from periphery to the heart and causes atherosclerosis. Total cholesterol is high, also bad for atherosclerosis. Total triglyceride or total cholesterol. And in here also, LDL is supposed to be less. LDL is a good cholesterol. They carry the bad cholesterol from heart to the periphery. High density lipoprotein, good. So if you do not control them, if you do not change your lifestyle modification, if you do not start the anti-cholesterol lowering agents or statin, atorvastatin, if you do not stop the progress of atherosclerosis, this lead to the coronary artery disease, and coronary artery disease lead to develop myocardial infarction. If myocardial infarction, if you do not stop, it can cause congestive heart failure, right? Congestive heart failure, or called CHF or CCF. CF or CHF, heart failure or congestive failure. Atherosclerosis is the leading cause of CAD. Diabetes mellitus is a risk factor for CAD. Diabetes is a silent killer. If anybody have a diabetic and atherosclerosis, they start to the MI without any sign and symptom. But it is not the most common cause. It is a comorbidity, two diseases together, right? But most common cause is atherosclerosis. Myocardial infarction is a common result of CAD. So as I told you, atherosclerosis lead to the coronary artery disease. Coronary artery disease, if untreated, lead to the MI. If MI does not treat it, MI lead to the congestive heart failure. If you do not take the proper medication, and heart failure lead to death, right? So, but two conditions are related here. What next? Next question here, we say the home care nurse visit a client diagnosed with atrial fibrillation who is ordered warfarin. Warfarin is a anticoagulant. Other name is Coumadin. The nurse teach the client about the warfarin therapy. Which statement by the client indicate the need for further teaching? So when you read the question, you could try to understand, to read the examiner mind. Which statement by the client indicate need further teaching? Means your client do something wrong, you need to correct them. Number one, I will watch my gum for bleeding when I brush my teeth. So gum swelling, gum bleeding, it is the sign of bleeding tendency. When you are under warfarin or heparin, the patient complication side effect is a bleeding disorder, ecchymosis, right? Or any kind of bleedings for epistaxis, nose bleeding. So gum bleeding as well. It is nothing wrong. Patient is okay. I will use an electronic razor during shaving. It is good. It's safer. Then number 4, I will report unexplained and severe bruising to my doctor in the right way. So means if you have any kind of bleeding tendency, right? If you have bleeding tendency, we have to notify to the healthcare provider, right? So it is nothing wrong, good. What about number 3? They said, I will eat 4 serving fresh green vegetables every day, right? This is the something wrong. So when the patient are under the warfarin or coumadin, we tell them do not take too much vitamin K containing food. What are the vitamin K containing food? It is fresh dark green vegetables every day. You do not need to tell your patient never take, but do not need to take too much because you are taking warfarin. What is their rationale? The client require additional teaching if he starts that he will eat dark green vegetables every day. Dark green vegetables contain vitamin K, which reverts the effect of warfarin. The client should limit his intake to 1 to 2 serving per day. The client should report bleeding gum or severe or unexplained bruising, which may indicate an excessive dose of warfarin. The client should use an electronic razor to prevent the cutting, right? And also it is prevent the bleeding. Sometimes NCLEX would ask if our patient have a warfarin overdose, what we could do. We give them vitamin K. If our patient has a heparin overdose, what we will give? We give antidote, which is called protamine sulfate. What next question here? Next question is here, we say, in presenting a workshop on parameter of cardiac function, which condition should the nurse list as those most likely to lead a disease preload? So let me show it is a little bigger here. In presenting a workshop on parameter of cardiac function, which condition should a nurse list as those most likely lead to a decrease the preload? What decrease the preload? Hemorrhage, epistaxis, and anaphylactics. Hemorrhage means bleeding. Sepsis means infection in the blood. Anaphylactics means allergic reaction. Myocardial infarction, it is ischemia, atherosclerosis can cause fluid overload. When patient has a heart failure or left side heart failure, patient tends to develop fluid overload, or right side heart failure, peripheral edema develop, or diuresis. too much speed, fluid overload, sepsis, and vasodilator, and also third, spacing, heart failure, and diuresis. So they said, which condition should a nurse list as those most likely lead to decrease the preload? Decrease the preload, one of the cause excessive blood loss. We call it hemorrhage, right? So rationale, preload is the volume of left ventricle at the end of diastole. It is also referred to as end diastolic volume. The preload is reduced by any condition that reduce the circulatory volume, such as hemorrhage, sepsis, and anaphylaxis. So, first of all, I want to tell you the heart, like a heart is look like this, and a heart has a 4 chambers, right? Heart has a 4 chamber, 2 atria, and 2 ventricle. So they said the preload means when heart is contraction, we call diastole, and systole means heart in relaxed phase. So when the ventricle is contracted, blood is going out through the aorta to the body, all over the body, right? Through the aorta. It is called preload. So preload depends on blood volume, and blood volume depends on hemorrhage or content. So like I said, blood pressure, BP, blood pressure equal to blood volume times or multiply total peripheral resistance, right? So it means when blood volume increase, blood pressure also increase. When blood volume decrease, blood pressure decrease as well. So now question, when blood volume decrease, like hemorrhage. Hemorrhage means blood loss. When blood loss means blood volume loss. When blood volume loss, blood pressure loss means heart does not pump out enough blood, so preload reduce. So hemorrhage or sepsis, anaphylactic shock reduce the blood volume, reduce the blood pressure, and reduce the preload. Let me rewrite it. Preload is the volume in the left ventricle at the end of diastole. Diastole is a contraction of the ventricles. It is also referred to as end diastolic volume. Preload is reduced by any condition that reduce the circulatory volume, means blood volume, such as hemorrhage, sepsis. Particularly, sepsis does mean infection in the blood all over the body. Anaphylactics means allergic reaction. Sepsis or anaphylactics lead to the septicemia or septic shock. Septic shock lead to the death. Hemorrhage reduce the circulatory volume by loss of volume from intravenous space, and sepsis and anaphylactic reduce the circulatory volume by increased capillary permeabilities. Diuresis, vasodilation, or third spacing also reduce the preload, and preload increase with fluid overload or heart failure, right? But preload reduce in hemorrhage, in sepsis, and anaphylatic reaction. What next? Next question here, a client is recovering from coronary artery bypass graft. It is shortly called CABG, right? Coronary artery bypass graft. Maybe something is blockaging because of atherosclerosis or coronary artery disease, and our treatment option is conservative treatment. If fail, we use the surgical management, coronary artery bypass grafting. The nurse known that for several weeks after this procedure, the client is at the risk for certain condition. During the discharge, the preparation, the nurse should advise the client and his family to expect which common symptom that typically resolve spontaneously, right? So during when time will come to discharge from hospital, as a healthcare provider, what we educate our patient that you maybe see or you maybe can face this type of side effect in future, right? So when you educate your patient, they will be aware, they will be concerned about this. It will be easy for them to coping. So they said the nurse known that for several weeks after this procedure, the client is at the risk for certain condition. During discharge preparation, the nurse should advise the client and his family to expect which common symptoms that typically resolve spontaneously: depression, ankle edema, memory lapse, and dizziness, right? So according to this, they said depression. Why depression? Why not ankle edema or dizziness? Let me read their rationale. For the first few weeks after coronary artery bypass graft surgery, the client commonly experiences depression, fatigue, or incisional chest discomfort. So fatigue is okay. Incisional chest discomfort is okay. Why it is okay? Because you have done a surgical operation at your chest area, definitely you feel discomfort. And also there's so many work over the heart, you feel fatigue, sometimes shortness of breath, dyspnea, or anorexia. It reduces the appetite. But why depression, right? Depression is typically resolved without any medical intervention. However, the nurse should advise family members that symptom of depression does not always resolve on their own. This should make sure they recognized worsening symptoms of depression and also known when to look for the care. So if all the time patient is sad, apathy, crying, do not eat, does not follow the grooming, right? Or if depression, we do not take care of it, it lead to suicidal ideation. So Ankle edema, another one, ankle edema or dizziness, sometimes follows after coronary artery bypass grafting and may indicate right side heart failure if patient have a ankle edema.